One. We are live, sir. Please start.
Good evening, everyone. On behalf of NASH 24/7, I welcome you to our public awareness program on Stepping Up for NASH. NASH 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. To break the silence on NASH, today we have a renowned gastroenterologist from Mumbai, Dr. Rajdeep More. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Rajdeep More is a leading gastro in Mumbai, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with GastroCure Endoscopy Center and Liver Clinic, which is in Mumbai. He is practicing as a gastroenterologist and hepatologist. So, sir, on this International NASH Day, we salute your dedication towards spreading awareness related to liver health and stepping up for NASH. Now, I invite Dr. Rajdeep to enlighten us on the topic. Sir, over to you.
Good evening, everyone. Thank you for that introduction. So I'm Dr. Rajdeep. I'm a consultant gastroenterologist and hepatologist in practicing in Thane. So today we'll be discussing about the details about a very, very important topic, which is very prevalent nowadays, and you might have heard a lot about it already. So we'll discuss about what exactly is fatty liver and NAFLD. So the International NASH Day, it was launched in 2018 by the Global Liver Institute and is celebrated across the globe on the second Thursday of the June month. Its main aim is to raise awareness about the NASH or non-alcoholic steatohepatitis and the actions that the people can take to prevent the disease. The theme this year is to step up for NASH. This year, the Global Liver Institute is inviting to step up for the patients for early detection as well as for the advocacy to defeat the NASH. So moving on to the various awareness activities Zydus has been doing and around the International NASH Day and celebrating the 6th International NASH Day. So we'll just discuss about what exactly this is. Let's move on to the next slide. This is just the basics that the liver is the second largest organ of the human body and weighs about 1500 grams with about 5% fat approximately. It is located in the upper abdominal cavity, just besides the stomach and above the intestines. Pinkish brown in color, soft consistency. It is also a very highly vascular organ. Moving on to the next. So it is important to, before understanding NASH, it is important to understand what are the functions of the liver. So as you can see on screen, it destroys the old RBCs. It helps in processing the nutrients as well as regulating the blood composition. Detoxification of the blood, removing the toxic products that are produced every day. Then production of bile, which is required for digestion of fat. It also helps to break down all the toxic chemicals, medications, as well as alcohol. Multiple metabolic processes are under the control of liver. And very importantly, it produces the proteins such as albumin, which are required for building up your immunity, as well as cholesterol metabolism. So understanding the functions of liver are very, very important because it performs a lot of functions which may get affected because of NASH or NAFLD. Moving on. So what exactly is NAFLD? So it is a condition in which fat makes up more than 5%. See, approximately normal fat percent is about 5%. So if it is more than 5% of the weight of the liver, not caused by alcohol, it can progress to what we call as NASH. So what are the conditions that are commonly associated with NASH? That is obesity or being overweight, type 2 diabetes, high cholesterol risk, or dyslipidemia as we call in medical terms. All these factors are associated with an increased risk of non-alcoholic fatty liver disease. Next. So in India, the prevalence of NASH is almost about between 20 to 30%. Previously, it was thought to be a disease of the Western population, but 1 out of 4 people have NAFLD, regardless of the weight. More than 6 diabetics and 9 severely obese people out of 10 have NAFLD. The male gender is being regarded as the risk factor for progression to NASH and fibrosis. Next. This is the sequence of events that unfold whenever a patient is affected with NAFLD. So you can see here the healthy liver. Once the excess deposit of fat happens because of the conditions mentioned, such as diabetes, obesity, or altered cholesterol metabolism, it can lead to fatty liver. Prolonged standing fatty liver can further cause liver fibrosis. Eventually, it can progress to what we call a liver cirrhosis that destroys liver cells and where the liver is unable to work properly. So this is end stage, and this is what we need to understand, that early intervention is something that will prevent cirrhosis. So let us look at the next slide. So there are 2 components of fatty liver. That is, one is NAFL and the other is NASH. That is non-alcoholic fatty liver and non-alcoholic steatohepatitis. So NAFL means only the fat accumulation in the liver. So that is known as steatosis. That this is the early stage where the excess fat is accumulated in the liver, which the liver cannot metabolize or remove. Further, when the steatosis is for a longer duration, it leads to inflammation of the liver cells or hepatic cells, and this condition is called as non-alcoholic steatohepatitis. The scarring of the liver begins and eventually progresses to fibrosis and then cirrhosis. Next. Just as mentioned, apart from obesity and metabolic syndrome, other factors also contribute a lot. Physical inactivity being one of the major reasons for fatty liver. The food intake, high caloric food intake, is also incriminant in causing fatty liver. Certain medications such as steroids or medicines which are immunomodulators can affect the liver and cause non-alcoholic fatty liver disease. And in some patients without the other risk factors, also they can develop NAFLD. That could be because of the genetic makeup or the genetic background, which can predispose to causing non-alcoholic fatty liver disease. Moving on. Yeah, so as you can see, overweight or obesity is the prime reason why fat accumulation occurs in excess in the liver. Whenever the fat goes above 5 or 10%, it leads to NASH and scarring. So this is a good picture to remember, that any amount of obesity, especially the visceral or the centripetal obesity that we see, is a known factor for causing NASH. Next. So this is bidirectional. So this is NAFLD and diabetes is bidirectional, which means that both are incriminated in causing each other. So this is a vicious cycle where diabetes increases the risk of NASH, and in patients who already have NAFLD due to obesity, there is a high prevalence of diabetes or a high chance of developing diabetes, almost 2 to 4-fold increased risk of developing diabetes. So this is very important cycle to understand, that it is a bidirectional relationship and one can lead to the other. Can we have the next slide? So what are the symptoms of NAFLD? How does one patient or how does a person know that he has developed NAFLD or not? So most of the patients with NAFLD do not have any symptoms. They may, many a times NAFLD is picked up incidentally when the patient has come for a routine ultrasound test or routine liver function test, blood tests which are abnormal, and then he's evaluated, and then you find out that the patient has NAFLD. However, most of the patients are asymptomatic. There can be some symptoms such as mild fatigue or some discomfort in the upper abdomen, which can happen because of the increased size of the liver. But largely, patients do not have any symptoms in the early stages, that is NAFLD. Once it progresses to NASH, that is when there is inflammation or fibrosis, there can be other symptoms and which can progress to cirrhosis, such as increased fatigability, confusion, which is encephalopathy. There is buildup of the fluid in the abdomen, decreased or loss of appetite, early bruising because of decreased production of the clotting factors, as well as unexplained weight loss. So apart from this, patient can even develop jaundice if the cirrhosis is there. And hence, at the early stage, diagnosis can prevent all these symptoms and complications to occur. Can we have the next slide? So as mentioned in the previous slide, most of the patients are asymptomatic. Fatty liver can be a silent killer. It is called as a silent killer because many a times patients are diagnosed at the advanced stage, and we misdiagnosing the patients in the early stage, which can be life-altering or beneficial to the patient in the form of blood tests, ultrasound or fibroscan, liver biopsy, as well as some imaging modalities like X-ray, CT, and MRI. We'll talk about each of them in the upcoming slides. Firstly, the blood test. So commonly what happens is the patient gets a routine test done, a liver function test done, and raised ALT or SGPT levels are seen, after which he is evaluated and found to have NASH. So it is one thing has to be understood, that up to 80% of NAFLD patients can have normal ALT. So a normal ALT doesn't rule out patient having NAFLD. So blood tests are to be supplemented by imaging modalities like ultrasound, fibroscan, or even a CT or MRI to know whether the patient has NAFLD. So at present, there are no specific cutoffs of ALT for prediction of advanced fibrosis or NASH. Next. Various scoring systems or scoring methods are established to diagnose whether the patient has NAFLD, because alone liver function tests are not diagnostic of NASH, since liver tests can be deranged in multiple other conditions such as alcoholic hepatitis, whether the patient has any viral infection or any other condition, patient is on some medicines which can cause drug-induced liver injury. So all these conditions cause derangement of the liver test. So we needed some other tests as well to accompany the liver test to understand whether the patient has NAFLD. So there are a few criteria which have been proposed by various liver societies. One of them is FIB4, which includes age, AST, ALT, platelet count, and the other is the NAFLD fibrosis score, which includes a BMI, fasting glucose, and albumin, along with the FIB4. So there are online tools which are available, and we can understand the risk, and these give a fairly good idea. I won't say that they are completely diagnostic, a fairly good idea as to which level or how much of a significant NAFLD you have. And they can be better. They're definitely better than only liver function tests, but they need to be supplemented with imaging modalities as well. Can we have the next slide? So non-invasive diagnosis. So now ultrasound, as you know, is a very commonly available modality in most of the interiors as well, or in all kinds of establishments. So ultrasound usually picks up whether the liver is normal, fatty, or cirrhotic, whether the size of the liver is shrunken, and whether the surface of the liver is damaged or not. It is easily available, economic, and many a times patients are found to have fatty liver on ultrasound, and that is when they come to the OPD to say that they probably have NAFLD without symptoms. The downside or the drawback is that it is not a very accurate test to detect all the NAFLD. It only detects about NAFLD only in fat more than 25%, whereas in the definition we saw that NAFLD is defined as fat accumulation more than 5%. So a large chunk of the early NAFLD is missed on ultrasound. And secondly, it cannot differentiate between NAFLD and NASH. Difference between fat and fibrosis is not very good. So USG is good in picking up NAFLD, but the detail as to which stage the patient is in or what stage of liver damage it is not ideal test. And we have better modalities which have come up now, which we will see in the coming slides. So this is one test that you will see your gastroenterologist or a hepatologist commonly recommend to understand which stage of NAFLD you are. So a diagnosis of NAFLD with fat of more than 10% is possible with a fibroscan or a transient elastography, which uses the shear waves. And depending on the shear wave values, you see whether the cap values as well as the liver stiffness measurement values are within the range or be deranged. So it helps. The advantages of transient elastography is it helps to diagnose early fat deposition, more than 10%, better than ultrasound, differentiate between fibrosis and fat content. And it is a fairly easy modality to use. It is a non-invasive test. So it hardly takes about less than 5 minutes to do the test. So very, very friendly for the patient and not cumbersome. The only downside being that in severely obese patients, it may not be well interpreted because the probe may not actually touch the liver surface and it may misinterpret in obese patients. Can we have the next slide? So as discussed, it is the controlled the liver stiffness measure as well as the controlled attenuation parameter. Both have different functions. So LSM indicates the degree of fibrosis and controlled attenuation parameter indicates the degree of steatosis in the liver. So both these parameters are important to know what stage of fibrosis or fat deposition we are at. Moving on to the next modality, that is the MRI PDFF, or what also known as MRI proton density fat fraction. So this is a very, very more accurate non-invasive test to diagnose non-alcoholic fatty liver disease. It is used a gold standard to detect the fat content. Commonly used technique for liver donor patients and liver transplant because it can measure a very, very small amount of fat as well. The downside being that not widely available and it is costly. So there are few centers who do this. Also, the expertise available in interpreting the MRI PDFF is not available in all the places. So that is one challenge with this modality. But as of now, it is one of the most accurate non-invasive diagnostic tests for NAFLD. Moving on to the invasive diagnostic tests that we have. Next. Yeah, so the invasive diagnostic test is a liver biopsy. So everybody must have heard about a liver biopsy. So this is the time-tested, age-old test to know what is the status of the liver, in which a small slender core of tissue is removed with a biopsy needle from the liver. And this was considered and is still considered as the gold standard method for diagnosing NASH. It is actually all the studies that have been done in diagnosis of NASH as well as recommending treatment have been done on biopsy-proven NASH. So biopsy-proven NASH and reversibility is very important for us to accommodate any drugs, new drugs, and show their efficacy. It also helps us to rule out other causes of liver disease, and so that patient is not misdiagnosed as NASH. So it can pick up the copper content in the liver, it can pick up the iron content. So all these other liver diseases can be ruled out by liver biopsy. Again, the main downside of liver biopsy, it is a painful test. It requires a certain amount of expertise. And if an adequate core of the liver is not attained, adequate tissue is not attained, there are chances of misdiagnosis. Also, the interpretation of liver biopsy requires highly skilled training. So that is also not available everywhere. So liver biopsy has its own challenges. And that is why we rely nowadays more on the non-invasive test that we just discussed. Let us move on to the further discussion. So this is just a summary of how NAFLD progresses. So most of the patients stay in who have fat deposition in the liver. Around 70 to 75% are only fatty liver patients. Throughout the life, they stay into this state of fatty liver or with mild inflammation. But 20% of the patients will progress to steatohepatitis, that is NASH, and eventually about 11% will progress to what we call as cirrhosis. So this is considered as a relatively irreversible condition where there is sufficient damage to the liver to impair all its function and lead to complications such as gastrointestinal bleeding. There can be ascites or collection of fluid in the abdomen, and there can be altered sensorium drowsiness because of hepatic encephalopathy. Beyond this, patients in the form of decompensation, and also there is the risk of HCC. So HCC is hepatocellular carcinoma. So liver cancer in a very, very small subset of patients can develop, but that small subset is still important. So that has to be kept in mind when you're treating or when you're seeing patients with NASH and NASH-related cirrhosis. Apart from that, patients with NASH will have some comorbidity in the form of diabetes, obesity. That leads to increased risks of death in the form of cardiovascular complications, malignancies, or liver-related decompensation complications, such as hepatic encephalopathy or GI bleeds. And fibrosis progression is significant with more associated with diabetes mellitus, weight gain, and rising levels of the liver tests. Can we have the next slide? So this is the take-home message for everyone that non-alcoholic steatohepatitis is a serious form. Initially, there was not much awareness about fatty liver, or it was often considered as a very benign condition, but it is a more serious form of the NASH is the most serious form of NAFLD, in which you may have the scarring of the liver and may lead to even cirrhosis or liver cancer. So that is something that you need to keep in mind when you come up with this diagnosis or when you realize and need to be evaluated thoroughly. Next, yeah. So moving on to a bit of treatment options that can be discussed. So the mainstay of treatment of NAFLD or NASH still remains in diet and lifestyle modification. So diet, exercise, lifestyle modifications are the mainstay of treatment of NAFLD and NASH, which means that there has to be some effort from the patient side as well. There are a few new medications which have come up, which have shown to have reversibility of NASH in the early stage and some amount of reversibility of the inflammation that happens. However, diet and lifestyle modification along with exercise is the most important modality or most important arm of treatment of NAFLD. Let us see what are the modifications that we can do or that can be advised to the patients. So regarding the diet modifications, yes, calorie restriction has shown to be helpful in reversing NASH. So has moderate intensity exercise. There are grades of weight losses that can help to improve steatosis. So if 3 to 5% body weight helps to improve the fat loss, whereas if you lose more percentage of the body weight, it can even reverse the fibrosis or the inflammation that has happened. So this is a very important point to understand, that the percentage of weight loss progressively as you keep on losing weight in a structured manner and with adequate exercise and by calorie restriction, you can actually achieve improvement in the majority of the histopathological features of NASH, including fibrosis. So we'll see in the next slide how is the resolution. So here you see the resolution is only with a weight loss of 3%. We can reverse the fat deposition or steatosis. With a weight loss of more than 5%, even the inflammation reverses. And about 7 to 10%, there can be resolution in the steatohepatitis. That is the significant inflammation. And sometimes, if the weight loss is more than 10% with a very structured and adequate exercise and diet restriction, even fibrosis can be reversed. So there have been various diets prescribed for healthy liver. We don't endorse a specific diet that can just that is one size fits all, because every individual has to be studied, and everybody's body habitus or dietary habits have to be studied. So this is just one of the diets which has gained prominence. So where there is a base, each of the vegetables, whole wheat grains, beans, nuts, legumes, and some seafood and fish, and some moderate portions of poultry, eggs, cheese, and yogurt. Also, along with it, physical activity and adequate intake of water. So this is the Mediterranean diet. This is just one example of one of the diets that has been followed. It is not a gold standard, but similar such diets have come up. It is important to visit your doctor or a practitioner to understand which is best for you, and it has to be an individualized treatment. Again, a very important point that needs to be highlighted is there are two types of exercises, that is aerobic and resistance. A lot of times, most of the patients are advised only to undergo aerobic exercises, which can result in weight loss, but it only fulfills part of our aim. Aerobic exercises reduce liver fat, maintains weight, and improves our cardiovascular conditioning and the conditioning of the heart. But resistance exercises are equally important because they improve the glucose absorption, they reduce the liver inflammation, as well as improve the metabolic parameters. So it has to be a combination of the aerobic as well as the resistance exercises, which can reverse the fatty liver, and not just the aerobic exercises. So this is another important message that should be understood. Next. Again, lifestyle. This is another important arm of the lifestyle, that lowering your sugar intake, eating small frequent meals, regular checkups, enough sleep, exercise, and overall lifestyle modification is extremely important to have a sustained result and not a short-term result. So unless you completely transform your lifestyle, you will not have the sustained resolution or sustained results that you can achieve with for reduction of NAFLD or NASH. So pharmacology, there are some drugs which have been approved by the INASL, which is the Indian National Association for the Study of the Liver. So the three molecules, that is pioglitazone, vitamin E, and saroglitazone is the new molecule. So pioglitazone is diamond tested OHA, oral hypoglycemic agent. So it can be used with or without fibrosis in both diabetic and non-diabetic patients for about 2 years. Vitamin E is also recommended, but primarily in non-diabetic patients. And saroglitazone is now being used in patients with or without fibrosis in both diabetic as well as non-diabetic patients for a duration of about 1 year. So these are the drugs that have been recommended by the INASL. Next. So again, just to summarize the tips to prevent fatty liver disease. So we have to limit the intake of saturated and trans fats, eat a balanced diet, most important thing, refined carbohydrate restriction, a healthy weight maintenance, and maintaining a lifestyle which can help you maintain that weight for a longer time rather than only for a short duration. Quitting smoking or quitting smoking and limiting or avoiding alcohol also go a long way in reversing NAFLD. Regular exercise and taking pharmacological therapies or medications as prescribed by your doctor. So specifically under the supervision of your doctor, the medications have to be taken and for the prescribed time duration. So all these factors and all these lifestyle modifications with the medications will definitely yield results in treating early fatty liver disease or NAFLD or NASH. So this was an overview about a very, very important condition called as NASH, and I hope that we can take home this message that we should not ignore fatty liver, or we should not ignore if anybody comes with a report of only fatty liver. he or she has to be evaluated thoroughly to understand how much is the liver damage. And also for the patients, it is important that you seek help or consultation with your gastroenterologist or the liver specialist to understand at what stage your NASH or NAFLD is, so that you can take steps to reverse it without it going into the advanced stage. Thank you for a patient hearing, and I hope it was helpful.
Thank you so much, Dr. Rajdeep. Thank you for this wonderful and enlightening talk. So now, with your permission, can we take some questions from the audience?
Yes. Sure.
Yeah. So we are having some common questions that audience is asking. So first is that what is difference between NAFLD and NASH?
Yeah. So as discussed in this, so NAFLD is the early deposition of fat. So liver so whatever fat that is produced in the body or which is taken in the diet is metabolized through the liver. When excess fat is either produced in the body or through your diet, if there is excess fat which cannot be metabolized by the liver, it gets deposited in the liver cells. And when this exceeds more than 5%, that is when we say it is NAFLD or non-alcoholic fatty liver disease. Now, when this non-alcoholic fatty liver disease stays for a longer time, it starts causing damage to the hepatic cells or the liver cells. And there is a lot of inflammation or inflammatory cells which are produced during this time, which cause some inflammatory reactions or inflammation of the liver. And this stage is called as non-alcoholic steatohepatitis. So the first stage of fatty liver is what we call as NAFLD. The second stage is NASH, and then further it progresses to cirrhosis.
Right, sir. Thank you. The second question that we have is about this diet that you have already mentioned, that if I do intermittent fasting diet, so will it be helpful?
Yes.
Or just I have to do the balance diet?
Yeah. So balanced diet. So there, as I discussed when the first slide of the diet was there, that one size does not fit all. It has to be individualized treatment. And definitely intermittent fasting has some benefits, but it has to be done under strict instructions. Also, only diet is not the solution for NAFLD. It also has to be supplemented with exercise. And I also showed what exercises are important, both the aerobic exercises as well as the resistance training. Both is important for us to lose adequate fat and to reverse NASH. So that has to be kept in mind. And I would strictly nowadays it's very common to have a lot of diets, and a lot of diets or different diets are being marketed. So you have to be a bit more cautious and take some adequate understanding from your doctor about what diet suits you best, individualized after consultation. That is the time that it will help you. But definitely the restriction of calories has shown to be beneficial in NASH in the long term. So it has to be done in a guided manner. Yeah.
Right, sir. Thank you. Sir, there is one common myth amongst the population that if a person is lean or is not obese, so there is no chance of getting NAFLD. So I just want to know more about that.
Yeah. So there is a concept now, what is called as lean NASH, where the patient may not be obese, he may not have any comorbidities, he may not have a very high BMI, body mass index, yet when his tests are done, he seems to have NAFLD or NASH. So one reason for that is genetic factors. So genetic factors and some allelic mutations play a major role in causing what is called as lean NASH. So you should not be under the impression that just because you do not have comorbidities or you do not have any high BMI, and if your sonography shows that you have fatty liver, don't ignore saying that I don't have the conditions or I don't have any other risk factors, so I should ignore it. There could be a genetic component underlying which could be causing NASH. So that is a new entity that has come up, and that has also helped us diagnose very lean patients as having non-alcoholic fatty liver disease or NASH.
Right. So even the lean patients are not safe. They
Yes,
can
they're
also
not. They're not. Yes,
get a serious problem if they are having
absolutely.
non-alcoholic fatty liver. Right, sir. Thank you so much, Dr. Rajdeep, for this wonderful talk. And on behalf of NASH 24/7, I would like to thank Dr. Rajdeep for this lively and informative session that he took. So, sir, as you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regularly visit and continue medication. With careful observation and precaution, it is possible to obtain control on the disease. I would also like to thank our audience for active participation and patience in making this event successful. Stay connected with NASH 24/7 on Facebook and take care of yourself and your family members. Thank you. Thank you so much, sir.
Thank you so much.